Hi everyone. In today's clip, I will talk a little bit about eye floaters. Just a reminder that anything I post here is not meant to diagnose or cure anything, and it's for informational use only. For any health-related matters, please consult your healthcare provider. So eye floaters are one of those conditions where three different medical traditions tell three different stories. Modern medicine mostly describes what they are. Orthomolecular medicine focuses on repairing the tissues, and traditional medicine often looks at circulation and nourishment and views them as a sign of imbalance affecting the eye, liver, brain, and the body's humors. So let's start with modern understanding. Inside the eye, there's a clear gel called vitreous, and it is mostly water with a framework of collagen and hyaluronic acid. It is believed that as people age, the collagen fibers gradually clump together, and the light passing through the eye casts shadows from these clumps onto the retina. And these shadows appear as black dots, cobwebs, strings, transparent worms, tiny rings, or clouds. So common causes include, of course, aging, nearsightedness, eye injury, cataract surgery, bleeding inside the eye, retinal tears or retinal detachment, and the latter two, of course, require urgent care. Modern medicine has few treatments because the floaters are not on the retina. They're floating inside the vitreous. So treatments include laser vitreolysis, which works for selected patients, and vitrectomy surgery. And this is effective but carries significant risks with it, of course. So there is currently no widely accepted modern medication that reliably will dissolve or get rid of floaters. From the orthomolecular perspective, we generally view floaters as degeneration or oxidation of collagen in the vitreous. And the goal is to reduce oxidation, improve collagen quality, improve circulation, lower the inflammation, and improve hydration of connective tissues. Now, common nutrients that are usually suggested would include vitamin C, because the vitreous contains one of the body's highest concentrations of vitamin C. The typical orthomolecular doses for this would be 2,000 to 3,000 milligrams a day or more in divided doses, depending on individuals' tolerance and the stress levels that one may be under, or any underlying causes and issues. The purpose of high-dose vitamin C is to do collagen repair, and to provide antioxidant protection. The preferred form is sodium ascorbate. Next, we have lysine for supporting collagen formation, which would be around 500 to 1,000 milligrams a day. We also recommend proline, which is 500 to 1,000 milligrams a day again, and this works together with lysine and vitamin C. Then we have MSM, or methylsulfonyl methane, which is 1,000 to 3,000 milligrams a day. This is a sulfur source for connective tissue, for collagen flexibility, and reduced inflammation. After that, we have hyaluronic acid. Since vitreous is rich in hyaluronic acid, supplementation is to support connective tissues. Then, of course, there's bilberry, which is the traditional European herb that is rich in anthocyanins, and it improves retinal circulation and protects the eye tissue. Then, of course, there's lutein, 10 to 20 milligram, and zeaxanthin, 2 to 4 milligram, and these are better known for retinal health than floaters, but they're often recommended in this case as well. Omega-3 fatty acids, or 3 oils, and this is to help reduce the inflammation. Krill oil being the best. And then there is zinc, 15 to 30 milligrams in the zinc picolinate or zinc bisglycinate format to support retinal metabolism. This is a short-term nutrient, and also start slow with this if you're doing this and not immediately at full potency. Then there is selenium, 100 to 200 microgram of selenomethionine to support antioxidant enzymes. And then there is N-acetylcysteine or NAC, 600 to 1200 milligrams daily, because it raises glutathione levels, and glutathione is one of the eye's major antioxidants. Next is CoQ10 enzyme, or for 200 milligrams daily, to support mitochondrial energy production. And magnesium, 200 to 400 milligram elemental, and magnesium glycinate usually is the first choice, and magnesium taurate is another good option. This is to support blood vessels and nerve function. On the traditional herbal medicine side, we aim to improve blood circulation and tissue nourishment. Now, frequently suggested herbs would include goji berry, blueberry, black currant, turmeric, ginkgo biloba, and eyebright. These are traditionally used to support circulation to the eye, or for the eye health, rather than specifically to dissolve the floaters. Also, in traditional medicine, visual disturbances resembling floaters centuries before modern ophthalmology have been considered as a disorder of the transparent eye media and the connection with imbalances of the body's humors. We often relate floaters to excess coldness, excess dryness, thick or impure humors, weak digestion, liver weakness, or brain weakness. Now, in this framework, healthy vision depends on pure nourishment reaching the eye, and hence there might be a need for digestive correction. Remember, digestion is the key and the foundation of eye health as well as any other system or organ health. Poor digestion produces impure body humors that can affect delicate organs, especially the eye. So we need to emphasize eating only when hungry, avoiding avoiding to overeat, good sleep, regular bowel movements, and liver support. The liver prepares nourishment for the body, and some of the most liver supporting foods would include things like barley, chicory, fennel, pomegranate, coriander, and lettuce. For brain nourishment, as the eyes are seen closely connected to the brain, the recommended foods would include almonds and walnuts in moderation, pistachios, fresh grapes, raisins, and honey. Now remember, the recommended nuts are best in the raw format, not salted or roasted, and preferably soaked overnight. If floaters are thought to come about from dryness, moistening foods like barley soup, bone broth, chicken broth, soaked almonds, fresh figs, and cucumbers would be the way to go. In traditional Persian medicine, we often use gentle massages, avoiding direct pressure application to the eye, as well as the eye cupping, which you rub your hands together and then sort of cup your eyes after the hands are warm, and applying gentle heat for blood circulation, were sort of included in the healing process. We also apply oils like sweet almond oil or violet oil or rose oil around the temples and in the forehead, and also scalp, because they calm and nourish. Now, these are not essential oils, they're actually infused oils. We also use eye washes, and not the ones that you can get in the pharmacy, of course, not the ones available in pharmacies, but warm teas, distilled pure rose water, if the eyes are sort of feeling tired or burning, or they're dry or inflamed. And this is done by a few drops in the eye, or as a compress. compressed, or as a compress. We also have fennel infusion, which is fennel seeds infused in distilled water and sort of strained and used as eye wash. There is chamomile wash for soothing tired, irritated, or swollen eyes, or cucumber wash, where you can put cooled sort of thin slices of cucumber on your eyes, or grate the cucumber and place the pulp in a clean gauze or cloth and put them over the eyes. And last but not least, saffron infusions. And for this, we take a few strands of high quality saffron, steep it in distilled water or rose water, and let it cool down a bit, and then use it as a compress. So, of course, it goes without saying that everything needs a lifestyle adjustment. So, avoid prolonged staring, excessive crying, excessive anger, and smoking. So, protect the eyes from harsh wind, eliminate or lessen the use of sunglasses, get adequate sleep, massage your eyes, walk daily to improve the circulation, and eat foods that are rich in antioxidants and supportive nutrients like eggs, carrots, spinach, kale. Kale is actually very important. Watercress, beets, black grapes, mulberries, barley, lentils, and oily fish, especially sardines. Relax and be grateful for life's small blessings and enjoy the beauty of what surrounds you. When you love what you see, you will see better. Hope this has been helpful. My clips are available on TikTok, Telegram, and YouTube. Like, share, and follow for more. Be the light.